Dr. Byakatonda Abdulhu, Member of Parliament representing workers. We are talking of the frontliners, and then we're also talking of all building synergies across the board so that we can actually be able to fight this pandemic. You realize that I think there are a number of gaps that require to be filled. For example, in terms of appropriation, in the Parliament we have not actually seen, when they are talking of vulnerable groups, but we have not actually seen that as a resolution taken by the resolution of Parliament. So you wonder how it is managed, what the stakeholders, I think we should remain in doubt. Like the issue of oxygen cylinders. Recently, His Excellency the President instructed that we should actually have a number of beds to manage the scourge, the pandemic. But I think the targets were not met. So this implies that we are ill prepared in all aspects. Something which can actually bring a positive danger. I think what we need to do in the future is that at least we should be proactive. Basically what we are doing now is being reactive. When something falls, then that's when you run. Let's run to Ogwang because there's actually invited the COVID-19. And yet these are things that can actually be done through proper planning. And the government has all these dockets that can actually ensure that, for example, when we are talking of disaster, there's disaster preparedness. When we are talking of appropriation, there is the Parliament. When we are talking of ill health, the means of health is available. When we are talking of availability of resources, we have means of finance. So that we keep on running around. And that's when you find that even the frontline workers, for example, the media, actually there is an arrangement for you, even in terms of facilitating you to work. You find that recently I was in Busia, I realized even again the frontline workers were ill facilitated, again being battered, being brutally tortured by, again, security. Who does always give them security? I think these are issues we need to look into, seriously. So as a matter of urgency, we would actually implore upon government, as well as resolution even of Parliament, so that at least we move towards this direction. You find that there has been a high level of complacence, because at the first level, the first COVID, you remember there was actually some arrangement. But again, this, which is more dangerous, and we are even anticipating wave 3, we don't have proper arrangement in place. So we cannot actually do things haphazardly. We need an arrangement in place to ensure that at least the fight is actually handled technically and absolutely. This calls for now policies on R&D, research and development. And there should be deliberate effort so that we have a funding in place. Where do we run to? Rather than just running as if it is just a bomb which has been fired into us. That has caused a lot of problems. As a workers' member of Parliament, I feel we need even to do job evaluation. Why would you really think a doctor or a nurse should get 2,000 for lunch, which is not even available anywhere? These are issues, and I think we have had a number of discussions with the President. He has even directed people to handle this. But we find people are just there, meandering with the whole thing. That's not proper. As government, I think we shall request that they take on this matter seriously. And of course, really, we should appreciate, like he has actually told you, if he had mentioned the number of deaths to the frontline workers, especially doctors in this scourge, there are quite many. And these are people who have left families. We can actually say, oh, we shall actually do this, but at the end of the day, these families will be languishing without actually any help. So life is very important even for the frontline workers. So it's a matter of urgency that we should look into this matter and ensure that at least the PPEs. I was in Busia recently. I went to hospital in the countryside. You find that actually a bottle of sanitizer is a dream. What are we doing doing a service to these people? Even as a press, you need actually to have these arrangements put in place, because your role must be also appreciated. Because one, in terms of capacity building, you are performing a lot. In terms of intervention, the medical practitioners are doing a great service. Social workers are counseling and psychosocial building, so that at least we fight this. So we require all fronts to fight this scourge. So I think as a matter of urgency, we would like to improve upon the government to ensure that at least they come up with interim measures that can actually facilitate. Because when somebody is not motivated, you find that actually not work properly. How do you work? People are sharing masks. People are actually using a mask for 3 days. So how do you really think that person will actually be spared of the scourge? So this is a matter of urgency, and we need to take it up with government to ensure that at least protection, PPEs are handled. Small things like first funeral allowance be actually given priority within our means, so that we can actually understand. Because recently, the nurses were also promised, the medical workers were promised, but nothing has come up. So we shall take on as leaders to ensure that we caucus with the government. As a matter of urgency, we need to see the Prime Minister to see arrangements are in place, such that at least the fight should not be actually given up. We should ensure that the fight has been given a priority and a concerted effort between all the stakeholders. And stakeholder analysis has not been done because we don't know who is responsible for what. Because if we're prepared, the key issues that are constraining the fight, you find that people don't even have food for their families as they are treating COVID patients. How do you go home? Is your family catered for? These are issues that should be looked into. Then in terms of career progression, who is responsible for what? You find that some people have been in those places for a long time. I think these are issues that we need to look into, and they must be given focus. So I really want to thank the Medical Union for coming up with these very, very pertinent issues. I want to assure you that we shall actually join you to ensure that we get the minimum standards that require the fight against this scourge.
My name is Sanya Aggrey, the General Secretary of Uganda Medical Workers Union. We are all aware in the situation we are in. All of us are aware we are in the second wave of COVID-19 in Uganda, and we have all heard what has happened. The COVID-19 pandemic has affected the labor market adversely, including loss of jobs, employment, increased levels of precarious work, etc. The health/medical force has been affected by the pandemic in more ways, including increased exposure to infection. Many health workers have contracted COVID-19 from their workplaces, and a number of our colleagues have lost their life in the line of duty. Given the special risk faced by health workers by nature of our work, COVID-19 is an occupational safety and health issue, an occupational hazard to the health workers. The International Labour Organization, ILO, and Uganda laws, that's the Compensation Act 206, set forth the principle that workers must be protected from sickness, disease, and injury arising from their employment. This mandate of protecting workers and employees falls squarely on the employer. Government is the lead employer for health workers at various levels. However, health workers in Uganda continue to face unprecedented risk of death from COVID-19 due to inadequacy of PPE, lack of access to affordable treatment when they contract COVID-19. In brackets, we cannot afford the various services that we provide, especially when we get to the level of requiring tertiary care. Long working hours leading to burnout, and in addition to the long-standing challenges of meager remuneration. In light of the above dangers faced by health workers, we call upon government to play its role in protecting its workers, as set by ILO standards and the laws implementing following proposals. 1. Prioritizing management/treatment of health workers who contract COVID-19. Set aside reserve space and necessary equipment for management of health workers battling with COVID-19 contracted in the line of duty. Subsidize cost of COVID-19 treatment to private health facilities. Loss of health workers is double tragedy because it depletes human resource capacity in the battle against the pandemic. Kenya Ministry of Health has created isolation centers for health workers at regional level and a hospital in Nairobi fully equipped specifically for health workers. Allow me to elaborate on this. In Uganda, health workers fall sick when the space has been taken up by our brothers and sisters from the the public. When a health worker falls sick, actually we fall sick after the community has fallen sick, and we find there is no space, there is no equipment. You are aware of a doctor who was transported from Lira with the oxygen, half cylinder, and the oxygen got finished on our way, which caused her death. So we are asking government to set aside isolation centers for health workers and get a hospital in Kampala. Kenya has done this. They can bank a benchmark from Kenya. And this one, we are going to come together as all health workers and take a decision on this. Without PPEs, health workers cannot provide quality routine health service because they live in fear of contracting the disease. Government ought to increase the resources allocated to procurement of PPE for health workers. Government should also construct an oxygen plant big enough to supply the whole country in cases of high demand. This will support the small plants in regional hospitals. We have seen around Kampala government facilities, regional hospitals lacking oxygen. We borrowed enough money. Government should put up a big plant around either Namamve so that it can produce enough oxygen. When such demands come, we have enough cylinders to support the small plants in regional referral hospitals. 3, government should provide risk allowance to all health workers. All health workers deserve allowance, irrespective of whether they serve in COVID-19 treatment units or not. Health workers working at OPD, that is outpatient departments, maternity wards, general wards, are constantly exposed to COVID-19 because these are undiagnosed cases. Patients walk in with signs and symptoms, but because they are not diagnosed, these health workers are in contact with these patients. So we are asking that all health workers should be given COVID-19 allowance. The risk allowance can be calculated based on amount of risk, e.g. those working in COVID treatment areas getting more. And lastly, number 4, lunch allowances for all health workers. Government has pronounced itself to increase lunch allowances to nurses in the financial year 21-22. Uganda Medical Workers Union welcomes and appreciates this endeavor. However, we call upon government to increase lunch allowance for all health workers across the board. Not only for a certain cadre, because all health workers operate in the same environment. Consideration of certain cadres alone is leading to agitation and discontent among other cadres, and it will lead to industrial action sooner or later. Uganda Medical Workers Union commiserates with the families of health workers who have succumbed to COVID-19 in the line of duty. We therefore call upon government to put the above issues immediately and urgent consideration to avoid further loss of frontline soldiers in the war against COVID-19 and improve working conditions to help health workers improve on the management of COVID-19 patients.
I'm really surprised that the medical stores, the other gentleman from the medical stores, they came in parliament and they was saying that the government has not released any money. For them, they are using their own money to buy the vaccines and so on. Where is the money? Where is the other money which was budgeted for? So I'm requesting our members of parliament to follow up and monitor that the money meant for COVID is actually used for COVID. We want to see all the doctors, the nurses, all medical workers with the proper protective gears. We also ask the government to create a special place for these medical workers. Once they fall sick, they don't put you where you have been treating people and you have been seeing people die. that alone can also cause more deaths to the health workers. And just losing one doctor, one nurse, and others, to train them is not easy. There's also issue of manpower, which you have not raised here. Most hospitals lack manpower. When you go up country, you find that some people stay in the ward for more than 8 hours. Now, when you stay for 8 hours, most likely you can contract the what? The disease, because the more you stay in an environment where it's contaminated, the more risky it becomes, the more vulnerable you become. So my appeal is, first of all, to fast track, because I heard the other day the Minister of Health was trying to recruit more health workers. Let them do it very fast. We want more people, and we want these people to be motivated, as the Uganda Medical Workers Union has put it very right.